We are here today to talk with Dr. Kwitko, one of South Tampa's most trusted eye surgeons.
Hi, my name is Dr. Geoffrey Kwitko, MD. I'm an oculoplastic, orbital, and neuro-ophthalmic surgeon located in Tampa. My office is at the corner of Azeel and MacDill. And we've been in this location for about a year now, but I've been in South Tampa since 1991. I specialize in cosmetic and reconstructive eyelid surgery. That means cosmetic eyelid surgery and also reconstructive. If you have eyelid cancers or eyelid malpositions, we fix those. Also orbital surgery. Orbital surgery is the bony cavity that the eye sits in, and diseases of the orbit, whether it's cancers or inflammations or infections, as well as trauma. And as well, I specialize in neuro-ophthalmology, which is diseases of the optic nerve. This includes optic neuritis and double vision problems. Cosmetic eye surgery is a very, very subjective issue, and patients ask me that all the time. They'll come in for a consult for what we call a blepharoplasty, which is cosmetic eyelid surgery, and they'll ask me, do I need this? And there is no answer to that because it's subjective. We have some people who come in this office who have a lot of excess skin around their eyes and they just don't want to do anything about it. And then we have people who have little wrinkles and it makes them crazy and they want to get rid of them. So it's very subjective and it's up to the patient. There are some instances where the excess skin around the eye is so bad that it causes blockages in vision, and in those cases insurance may cover to have your surgery done.
Dr. Kwitko, can you walk us through a typical step-by-step process from the consultation to the surgery?
We'll get their paperwork done and make a chart for them. They will then come into the room and we'll examine them, check their vision, examine them for any eyelid malpositions, see if there's any eye disease happening. Look in the back of their eye, make sure their retina's okay. And once the complete eye examination is done, we'll sit down and talk to them about their problem. Now, if they've come in for a cosmetic consultation, we'll sit down and talk to them about what they can expect, what they can expect after surgery, the post-operative course, what they have to do post-operatively, and how long till all the swelling and bruising has become alleviated, so that they have an idea of what they're in for if they decide to go ahead and have cosmetic eyelid surgery.
What can a typical patient expect after surgery?
After surgery, we ask them to have somebody drive them home. They may or may not have eye patches on, depending upon if we do one eye or two eyes. If they do have eye patches, we'll ask them to take it off either that night or the next morning. Ointment goes on the stitches if they have stitches for about a week. Swelling and bruising is normal. Some people have it for a week, some people more, some people less. We ask them to use ice for the first 24 hours as much as possible. I will see them post-op day 1 or 2 to make sure everything's healing the way I want, and then we'll see them about 3 weeks after that.
Okay, so what's the typical recovery time for something like that?
Usually about 3 to 4 weeks until all the bruising and swelling is gone. Most of the swelling is gone after a week or so, but until everything is gone and all the stitches have fallen out, it's usually about 3 weeks until everything's back to normal.
So you can resume your life and go along in a normal, no one would even know that anything had happened except for the fact that maybe you look a little better.
Correct. And the next day, most people, they can do office work. Everybody's different. Some people want to get back to work the next day. Other people want to take some time off. But the next day you can go back and do office work. The only thing I ask is that you keep everything clean.
Dr. Kwitko, what makes someone a good candidate for eyelid surgery?
Well, we would like everybody as healthy as possible, obviously. If we're talking cosmetic surgery, we want them, again, as healthy as possible, realistic expectations, understand what to expect afterwards, understand the post-operative process, understand they're going to have swelling and bruising for a week or so, but most importantly, that they're healthy, there's no contraindications to doing surgery on them, and that they have realistic expectations. Now, doing eyelid surgery for other causes, for functional problems, let's say they have an entropion where the lid is flipped in, it's scratching the cornea, and the cornea is starting to erode and they're at risk for a corneal ulcer. Those patients need to be done because they could lose their eye if they end up with an ulcer. So, those patients will They may be sicker patients, they may be more elderly patients with more concomitant health problems. But again, you always weigh the risk versus benefits when doing surgery on a patient, and if it's a matter of saving the eye, then we will put up with a lot of medical problems in order to accomplish what we need to keep the eye healthy. Okay. One of the common problems that we do see, just pain in the eye, and I get patients sent to me from different doctors for many reasons. A lot of the times they're just sent to me for pain, and the patients don't know why, and the doctors don't know why they have pain. And a lot of it turns out to be dry eye. Very common, probably 60% of the people who come through my office for all reasons have dry eye to a certain degree. And it's really been trivialized and ignored up until now, but can cause a lot of problems. Again, you'll have sandy, gritty, foreign body sensation in the eye, light sensitivity, inability to read for any long period of time. And there's a lot we can do for dry eye, starting with drops, repairing eyelid sagginess, punctal occlusion to keep the tears in your eyes longer. And it does help your eyes quite a bit so that you can function better. So that's one of the more common things we see. The other thing, obviously, is for cosmetic eyelid surgery, people wanting to give themselves a more youthful appearance. And so those are the two big things where people will come in off the street inquiring about that we can help them with.
We'd like to thank Dr. Kwitko for joining us today on 44 on the Town. For more information, visit them at kwitko.com.